Hello, hello. Welcome to another interview for the Beat Executive Series. I'm Jody Tropiano-Green, the head of content at Health. Here at the Vibe Conference, we're on day three, I think, at this point. Yeah. Anyway, really excited to be here with Dr. Myra Ahmad, the CEO of Mochi Health. Thanks for joining us.
Thanks for having me.
Yeah. So I have a few questions for you. First, really want to just get to kind of the heart of what Mochi does. And everyone talks about patient-centered care, but I think Mochi really practices it. So can you tell us a bit about that?
Yeah, absolutely. We are a platform for comprehensive care for patients that includes everything from establishing a continuity care provider. We do over 2,000 plus medications, and we really see ourselves as like a comprehensive primary care practice. So we started in GLPs. We've now grown into 15 plus treatment areas, and pride ourselves on really owning that provider-patient relationship.
Yeah,
so,
that's great.
Yeah.
And we'll get a bit into that. But first, I want to stick on the GLP-1s for a second.
Yeah.
You really can't go to any healthcare conference without talking about that. And I think cost is a big part of that conversation. It could cost upwards of $1,300 a month, which is just not accessible to most patients.
Yeah.
So you've really flipped that at Mochi and made these medications a lot more affordable and accessible. So can you tell us a little bit about your pricing strategy?
Yeah. Our goal is for these medications to be at a price point where patients can get them with or without insurance. That really depends on whatever care plan them and their provider set out for, right? So because we have this marketplace structure where pharmacies and patients can work together to pick from any number of medications, providers get to really customize their treatment plans with patients. We do the whole prior authorization process. We try to find what is going to be the right medication each time.
Yeah. That's great. And I know that the statistics are pretty staggering with just the number of patients on these medications. So whatever we can do to increase access is a good thing.
Yeah.
And I know you started in weight management and obesity care, but now you're expanding, like you said, to 15 plus different indications. So can you tell us a little bit about that?
Yeah. We found that our providers and patients wanted other treatment areas on the platform, right? Our providers were wanting to do this other types of care. They had the specialties for it. We have so many specialists across like GI, primary care, family medicine, pediatrics, OB-GYN, endocrinology, tons of other ones. And our patients also didn't have primary care providers or were looking to this provider to do their other prescribing because they didn't really like their other primary care provider. And so it kind of was a natural next step, right? Like adding in other medications and taking over other parts of the care plan. Yeah.
And you have a unique model. You connect patients with pharmacies and independent physicians, a little bit different than your standard telehealth practice. So what makes your model so unique?
Yeah. A lot of the focus for the providers is that this is a place where they can establish their practice. We give them an EMR system. We give them a way to market themselves to patients. And we put them in this marketplace so that they can build out their practice, really. For patients, the value prop is this access to this unique group of tailored providers that we've done a lot of evaluation on of how they are building relationships with these patients. And I think that is very unique. And then on the pharmacy side, we do end-to-end pharmacy software. And so patients can really get visibility and tracking into all their medications and compare from different pharmacies and get access to so many other treatments.
And with all of this, you've been able to stay cash flow positive, which is a great thing. A lot of founders here at the Vibe Conference that I'm sure would love to be just that.
Yeah.
But you've been able to do it and keep these medications affordable for patients. This model, some say wouldn't work, but you're proving them wrong. So what do you have to say about that?
Yeah. A lot of the operational inefficiency in healthcare is through either tons and tons of administrative hiring or inefficient operations in general, right? That's like what makes up 90% of the healthcare cost of a hospital system or any big practice. And a lot of AI has helped with this, and also, honestly, a lot of efficiency in the way that we build software to automate a lot of these processes.
Yeah. And I think telehealth, it's been around quite a bit, but I would say maybe it's at an inflection point right now.
Yeah.
So do you agree? And where do you see Mochi fitting in this inflection point?
Yeah, I think consumer health has gone through a lot of phases in the last 5 years, right? There was COVID, and I think there was a lot of interest and investment into healthcare solutions for patients. And then there was this post-COVID couple years where there was almost nothing. And now we're kind of picking back up as a lot of investors in the community really realizes that that consumers are willing to pay for health solutions. There's still increasing number of patients that are going on to high deductible plans. They are basically being forced to cash pay for everything. And so solutions that make price transparency a priority are increasing, right? Things where you know what you're going to pay for your provider and where you know what you're going to pay for your medication. That is like ultimately what people want. So.
But
Yeah.
not so simple, but that is what patients want. So.
Yeah, if you could pay 90% less and get your provider and get your medication, and like those are the two things that you actually want to pay for, like that's what the solution should be.
I hope that's the future.
Yeah.
Dr. Ahmad, thanks so much for joining us today.
Yeah, thank you for having me.
Thanks.